Hi, I'm Dr. Shikha Sharma, and today I will be telling you about the difference between modern nutrition, Ayurvedic nutrition, and the protocol what we run, which is called Vedic nutrition. But let's first understand what is this Vedic nutrition we are talking about. So, Vedic nutrition is an integration of the best practices of three streams. What are those three streams? The first stream is Ayurvedic nutrition. That is the first stream. The second stream is the best practices of modern nutrition. And what are those best practices? The understanding about proteins, understanding about carbs, understanding about vitamins, understanding about minerals, understanding about uh, essential amino acids. All that is one of those what I say a best practice of modern nutrition. And the third is the best practices of medicine. So, being a doctor, what I saw was that if three aligned sciences were brought together and a protocol was built, what we call Vedic protocol, it could be more powerful and useful. Now, in this protocol, what is the aspect of modern medical science what we use? The first is diagnostic reports. That means a blood test has to be done in which your details of your blood, which is your hemoglobin, your liver function test, kidney function test, your thyroid levels, all that have to be seen that what is the current situation, what is the current status of your internal health. You can't plan a nutrition plan without knowing the body. And it's very wrong and irresponsible if somebody is planning nutrition plans without looking at your blood test reports, because that's very unscientific and it's just shooting in the dark. So every professional nutrition coach or a functional medicine coach or a doctor or a nutritionist who believes in holistic nutrition and nutrition for healing, the first step is always look at the blood test reports. Don't plan anything without looking at the blood test reports. It's unscientific if you do it otherwise. The second part, which is, or the first sub part of the aspects of modern medicine, what we have brought into Vedic nutrition is the understanding about how digestion happens. How does the body digest the food and then use the food to build itself, which is called anabolism. And how does the body break down old cells and auto digest and throw it out of the body, which is called catabolism. So anabolism is how you build cells. A typical example, which I think everybody would understand, is our blood cells. Our blood cells are built, fresh blood cells, and every 3 months they are replenished and fresh blood cells are made. Nobody asks what happens to the old blood cells. The body has the power to break them down and flush them out of the system. And it happens at various organ levels, in the liver, in the kidney, at the organ level. So that this anabolism, which is building, and catabolism, which is destruction and removal, is a very integral part of modern medicine. And people who have studied modern medicine, like I studied medicine, I'm an MBBS doctor, an allopath doctor. So this was taught to us. So we understand the body as a dynamic, moving body where anabolism, catabolism is happening together. Now, what is a part of Ayurveda, what we are bringing in? Now, most people only understand Ayurveda as medicines, which is unfortunate because it's a very limited part of Ayurveda which people are understanding. Ayurveda is huge. Ayurveda is a fantastic science with so many subsets. One of the subsets is nutrition. In Ayurvedic nutrition, something which is very wonderful and fantastic is the understanding about each body type needs different nutrition. You cannot feed the same thing to everybody. So every body type is built with a certain structure, with a certain metabolism, with a certain energy. And it is different for different body types. It's almost like, if I try to simplify it, or rather I would say oversimplify it, it's like your DNA, it's like your blood group. Like different people have different blood groups. You can never think of giving somebody with an A negative blood group and O positive blood. The patient will die. Similarly, different bodies have different DNA, which is basically a manifestation of how your body has been built. What is the code used in your body? So your DNA is your code. And unfortunately, most people don't even know that in Ayurveda, the nutritional code was explained. The code of nutrition was explained very, very in great details. That this is the body type and this is what you should eat. If the body type is different, then this is what you should eat. That is just one layer of Ayurvedic nutrition. There are another two layers, in fact, multiple layers of Ayurvedic nutrition, which are so beautiful. The second part, which I want to discuss, is the seasonal aspect. In summers, you have to eat differently for different body types. In winters, you have to eat differently for different body types. So that's different. That's something unique which we have brought from Ayurvedic nutrition. Another beauty of Ayurvedic nutrition is the huge understanding about herbs. We all know that we use ginger for sore throat. We all know we use ginger for revving up the metabolism in our livers. That ginger, that the healing impact, the physiological impact of ginger goes beyond the calorie concept. It is the physiological healing power of ginger, the dynamism of how it works inside the body. And that is true for many other herbs, whether it is aloe vera, whether it is tulsi, whether it is cinnamon, whether it is honey, cardamom. All of them have medical or medicinal value. And this medicinal value is taught in Ayurveda. So Ayurveda is not just about an Ayurvedic medicine. It is about food as medicine also, as kitchen spices as medicine also. And this is the beauty of Ayurvedic nutrition or Ayurvedic ahar. So the three components, which is modern medicine and diagnostics and digestion, physiological nutrition, the understanding from modern nutrition, the macros and micros, and understanding from Ayurveda, all these three things. So this is the combination which is part of the protocol what we have built at OneHealth called the Vedique protocol. Now, I'm sure a lot of you must be confused about, give us an example. Give us a simple example of how it works. So let's pick up a very typical disease, which is very common, diabetes. Now, most diabetics only understand diabetes in a very reductionist view, that diabetes is a disease where the sugars are going high. And they misinterpret this whole understanding as thinking that we don't have to have anything which is sweet. So they will not eat mangoes, they will not eat bananas, they will not eat rice, they will not eat potatoes, they will not eat anything which is sweet. Of course, they will not eat sugar, they will not eat jaggery, they will not eat honey. And yet, their diabetes is only becoming worse with time. Why? Because it's of the reductionist mindset. They don't understand how diabetes starts. If you don't understand how disease starts, and you apply a very reductionist logic towards treatment, it will not get treated. Like, for example, a lot of people think that a pimple is only skin deep. It's not. It's a hormonal thing also. It is related to your liver also. It's related to your digestive system also. If your liver is unhealthy, if your digestive system is unhealthy, if your elimination system is unhealthy, if your hormones are going in an imbalance, your hormonal balance is not there, your pimple will not get corrected. You can put all the lotions and the creams and do whatever you like. It'll come down, it'll come up. It'll come down, it'll come up. And that is why women who go through hormonal flushes or teenagers who are going through hormonal changes, their pimples become big. But even in that, Ayurveda has a concept about what is the kind of food which will reduce that hormonal flux, which doesn't mean that the hormones will come down, but the negative aspects of the flux will come down. And the negative aspect of the flux is elimination is not happening. The end products of hormonal metabolism are not being flushed out of the system, they're just adding to the acid of the body. Because this age is high fire, high pith, high acid. Teenage is high fire, high pith, high acid. And that is why a lot of alkaline foods have to be given to counter this high fire, high acid. But if you are giving foods which are going to increase the fire and affect the liver, pimples are a given. It's understood you'll get pimples. So, again, coming back to diabetes, if you're following a simple modern nutrition plan for diabetes, the plan will look something like this. In the morning, you get up and then you can have water, then you have your cup of tea or a coffee, and then you will have brown bread toast with or without butter. Tea or coffee will be without sugar. Then you will have you can have egg and toast, or you can have something similar. Then for lunch or for mid morning, you can have light biscuit, which is sugar free biscuit, or you can have, or some people choose to have, they don't like tea coffee, so they have zero cal aerated fizzy drinks. So there are a lot of zero cal drinks in the market, in the supermarkets, and they'll have one or two, they'll gulp down one or two of those drinks because they don't like tea and coffee, they want something cool, so they'll have that because it says zero cal and zero sugar. So they'll have these zero sugar drinks. Then for lunch, they might be on a portion control, so they'll have some meat or chicken or fish, and they'll have bread, or if it's an Indian meal, they'll have rotis, they'll have sabzi, they'll have dal, they'll have dahi, and that's their meal. And then in the evening, then again they will have tea, coffee. They will have some light biscuits, or they'll have some salted biscuits. And then for dinner, they will have, say around 10 o'clock, they'll have dinner. Before dinner, they will have some namkeen snacks, which is salted, savory snacks. So no sugar, savory snacks. And then for dinner, they will have 2 rotis, sabzi, dal, or a chicken or a fish if they're non-vegetarian. Now, this is a standard diabetic diet, which has removed all the white sugar and all the sweet things, so no fruit, nothing, and has this diet. But can I tell you what is wrong in this diet? Firstly, I'm sure many of you would have figured out that zero cal drink is harmful for diabetes because it's chemical, it's affecting your insulin levels. You will not get better, and it will in fact hit your insulin levels and spike them. The second problem is the salted biscuits. It's not the salt which is the problem. It is the biscuit itself which is the problem. It's made of maida, white flour. How can somebody not realize that white flour is sugar? Just because it doesn't taste sweet doesn't mean it isn't sugar. It's sugar. So that salted biscuit is made from white flour, which is sugar in the body. Plus, it has chemicals. It has artificial flavor, artificial color, it has preservatives. Again, it will hit your insulin, and you will not be able to control your blood sugars. The third thing which you might have identified is there was no fruit, there was no salad in the diet. How can you treat diabetes without having foods which heal the body, which balance the body? If you're not going to heal the body, the diabetes only getting worse day by day. There's no fruit, there's no salad in the body, in the diet, and that's a problem. There's no antioxidant, there is no healing vitamin. How can you heal the body without antioxidants? And finally, if you would have also noticed that dinner was late, that means the body doesn't have time to heal itself at night. At night, the body heals itself. The later you have the dinner, the more you are loading your body and more your insulin is going to spike. Now, what is a typical Vedic nutrition diet? How would it be different from this diet? Number one, the diet for each diabetic would be different depending on what is their body type. Are they ectomorphs? Are they mesomorphs? Are they endomorphs? Are they fire type? Are they water type? Are they air type? So that diagnosis first is done. You can call it it's sort of a phenotypic diet, a diet in which the phenotype, the body metabolism is first diagnosed, assessed, and then the diet is planned. Because eventually, if you can't digest, if your liver is different, you are a different kind of a metabolic burner, you will not adjust to the diet. You will not be able to get results from the diet, which in modern times is called nutrigenetics. But it starts from a genetic test, and this starts from a phenotype assessment. The second difference would be that depending on the body type, There'll always be some herbs and herbal drinks to give a boost to the liver. The herbal drink could be as simple as a ginger basil drink, or it could be something like a fenugreek uh, cardamom drink. It could be something simple as an aloe vera amla drink. But there would be definitely some beverages to heal the liver. Because if you don't heal the liver, your diabetes is not going to get under control. It's out of question. Your liver has a deep connection with insulin. So that healing thing would be given. The second difference would be there will always be fruits in the meal, depending on your body type, depending on your what kind of metabolic burner you are. There'll always be fruits in the meals because fruits and salads are the only source of enzymes. If you're not getting enzymes, how will your body heal? If you're not getting antioxidants, how will your body heal itself? And the body has to heal itself if you want to improve your diabetes. Third thing, obviously, is that it would have grains which suit your body. It's amazing that how people think that everybody will do well on wheat, and the whole world is only eating so much of wheat, and the wheat which is coming with pesticides and chemicals. All other multigrains have been dropped, which is unscientific. There is quinoa, there is ragi, there is jowar, there is bajra. There are so many grains which humans used to eat before the world became homogenized into just rice and wheat. And the whole world started just eating rice and wheat. At least in the metros, that's what people do. So it's meat, dairy, rice, and wheat. So different body types need different kinds of grains. And that is very important to understand. You cannot just be living off wheat or rice to be healthy. The third thing which is very important is that depending on again your body type, you would always be getting some kind of vegetable juices which balance and heal and help to improve your insulin sensitivity. Now, one major aspect of diabetes, which very few people talk about, is inflammation. Diabetes is a disorder when the body is having inflammation. And in modern nutrition, it's completely forgotten to treat that inflammation. If you don't treat that inflammation, you cannot get the cells to be sensitive to insulin. The reason why the cells stop responding to insulin is because of the inflammation. And therefore, treating the inflammation is a critical aspect of treating diabetes. And that is part of Vedic nutrition, treat the inflammation. And finally, I would say that diabetes is a multifactorial disease. So unless you also help the patient with coping skills of stress, which is breathing and which is movement, I'm not talking about exercises right now, I'll come to it later. Breathing is different. Breathing is what drives the entire energy system of the body. And if your stress is triggering wrong kind of breathing, your diabetes will not get resolved easily. So how to breathe right? Breath work is very important. When I talk about movement, in yoga, people mistake yoga as some kind of a calorie burning exercise. It's not. Yoga is not a calorie burning exercise. The science of yoga is far deeper because it affects 3-4 layers of the body. The first layer is the musculoskeletal layer, where even in muscles the insulin is being made. So if your muscles are weak, your insulin will not be made in the muscle and the load goes up in the liver and pancreas. So you need your muscles to create insulin. Second, so first is the yoga improves the musculoskeletal layer. The second is yoga improves the communication within the body, because diabetes is also lack of communication. The cells, the end cells are not able to communicate with the hormone. So yoga also helps in the communication improvement. It improves the communication by moving the energies. and internal glands are also pressed at different asanas. So it also impacts the glands by the different postures and the different pressure points which get impacted during yoga. So it's at level 2. And level 3 of yoga is, because yoga always starts with breath work and ends with meditation. So it calms the mind, and most diabetics report that their stress has triggered their diabetes. So yoga, because it starts with breath work, goes up into physical exercises and ends with meditation, is a holistic format which needs to be done by every diabetic. And if it's not being done, part of the treatment is missing in diabetes. So Vedic nutrition understands and appreciates this and includes that it has to be a holistic and not a reductionist method. So if till now you've been following a reductionist program where you just cut off sugar and eat all other things, including foods that are inflaming your body, it's time to let that go and move to a more scientific, logical, sensible, and holistic way of treating your disease and managing your disease, in which you have Vedic nutrition and you have yoga, you have breath work, you have meditation. Because the body cannot be treated in parts. The body has to be treated as a whole. And if you don't treat the body as a whole, then you can't treat the disease, because the disease is multifactorial, which means it has many, many, many factors. So this is about diabetes. We'll be talking more about diabetes. We'll be getting deeper into the specifics of diabetes. Keep watching this channel. And if you have any questions, please do share with us. We'll be more than happy to have our counselors talk to you. But otherwise also, if you want to study about Vedic nutrition, please reach out to us. So we do consulting with patients. We also teach. So if you want to learn more about the disease and you want to do a certificate course, we also do that. So reach out to us for any questions, clarifications. We are more than happy to help you. Stay healthy, stay safe.